name is Erica Hawley, and I'm a registered nurse who's returned to school for my Bachelor's of Science in Nursing at Polk State College. Today I'd like to talk to you about a topic that is an essential part of becoming a strong nurse leader. It can also support our growth as professional RNs. This topic is motivation. It's a good topic for the audience because as nurses, we all know that nursing burnout is a real phenomenon. Our job can be demanding and very stressful, and so motivation can be important for us personally and to share with others so that we can help combat those feelings of burnout. I read an article by a registered nurse named Elaine Llanos. This was a continuing education piece entitled Motivating Coworkers. Ms. Llanos made a poignant insight at the beginning of her article. She said that nurses are considered caregivers, but truthfully, our real role is to help others help themselves. There are 3 factors which can make or break our need or level for motivation. These are extrinsic factors or external influences like bonuses, employee evaluations, or patient comments on the surveys that they return to the hospital after their stay. Then there are intrinsic factors or internal influences like our interests or our curiosities, our values, or that good feeling that we have in our heart when we do the right thing for our patients. If we can learn the specific factors that motivate people to do their best at work, then we can individualize our methods for motivating others. According to the self-determination theory, there are 3 concepts that when experienced all together can create the highest level of motivation. These are autonomy, competence, and relatedness. We should try to develop these qualities in our daily work to help become more motivated. If we also highlight these concepts in another's performance, we can help to motivate them. Llanos advises we practice transformational leadership skills. If you recall from the beginning of our semester, we studied this, and our textbook described transformational leadership as a process where leaders and followers raise one another to higher levels of motivation and morality. But we don't have to be nursing leaders at this point in our career in order to motivate our coworkers. We could do so by simple gestures, like complimenting their strengths, because we all have a nurse on our floor who's really good at starting IVs. Or we could nominate someone who we think deserves an award, like Employee of the Month. Don't you think that someone would be more motivated to come to work when they know they're being recognized for their good qualities? Another way we can improve our motivation on the floor is by joining a nursing council or governance group. In these areas, we can be more vocal about ideas and policies that are being implemented on our unit. That will increase our motivation. We could also meet influential nursing or administrative staff, and sometimes being around these kind of people and seeing their attitudes and hearing their advice can also increase our motivation. We should develop a positive outlook when addressing negative issues at work. Research shows that a positive approach is more effective at building motivation. For example, the other day I was working with a patient care assistant on our floor who was complaining about all of the many changes that are underway in our department. Rather than complaining with her or encouraging her negative comments, I reminded her that in a few weeks, these changes would not be new to her anymore, and she could return and feel confident in her job again and be one of the best PCAs that we have, because she truthfully is. And I know she appreciated my comment because later I did see a change in her attitude. Motivating nursing staff enhances improved patient outcomes. I'd like to end with a comment by the famous Zig Ziglar. He said, "People often say that motivation doesn't last. Well, neither does bathing, and that's why we recommend it daily." We should keep this in mind because there are days we wake up and we just don't feel motivated, or we don't feel like motivating others. But if we make a conscious effort every day to do little things to motivate others, in the long run we could see a huge benefit within our department, within our rapport with other coworkers, and overall for the care of our patients. Thank you for your time. Please feel free to ask me any questions on the discussion board.